Hi, I'm Krista Amos. I'm going to be doing my rehearsal speech from my first speech, which will be my informative speech. It's going to be based on cardiac care. I've been a cardiac nurse for over 2 years. I'm still a new nurse, but I know a little bit about the cardiac field. We're going to talk about it a little bit in my group. Well, on the floor I work on, it's a telemetry floor. Telemetry is a heart monitor. Sometimes it's 5 leads, which is upper, mid, and lower. And sometimes the telemetry only has 3 leads. With the telemetry, we have a telemetry tech that will sit there and watch the heart monitors 24/7, and they'll notify the nurses if there's anything going on. So that's pretty one good thing about the cardiac floor. What I want to start my speech on is I'm going to ask some questions. I want to know if anyone has had any chest pain in the past and what was it like, or if they know someone who has had chest pain and what was it like. I want to sit and compare different things so we can kind of get an idea of what different occurrences were like, so we can kind of understand that no one's chest pain is exactly the same. Sometimes it starts, a lot of times you hear it starts as pain or pressure in the chest and it goes down the left arm. You hear that a lot. Or it starts as pain and pressure in the chest and it goes up into the jaw. And sometimes I've seen before where it started in the upper back and it wrapped around to the front of the chest. Don't hear that too often, but it happens. And then next we're going to talk about some things that are mistaken as cardiac chest pain. One of the main things is indigestion or reflux is mistaken as cardiac chest pain a lot of times. And another thing is the musculoskeletal system. If you pull muscle by lifting something too heavy or doing something too strenuous, and pull a muscle, that's a lot of times mistaken as cardiac chest pain. Those are the two other main things that are mistaken for cardiac pain. The main causes for cardiac pain, one of them is cholesterol buildup in your arteries. Whenever cholesterol builds up in your arteries, it causes a hard, thick plaque. And that kind of blocks off your artery. It's kind of hard to get out. Another thing is a blood clot in your main arteries causes chest pain or a heart attack. And the last thing is spasms of the blood vessels around your heart can cause some chest pain. One of the main things that they want to start you on as soon as you're having chest pain is an anticoagulant, which is a clot buster, some people say. It makes your blood a little bit thinner, just in case if you have cholesterol building up in your arteries, it can go through a little easier. If you have a blood clot that's clotting off your main arteries, it will break up that clot, and that's one of the first things they always want to start someone on if they're having chest pain, until they figure out if it's cardiac related or not. Before they want to start treatment just in case it is cardiac related before it's too late. Some risk factors that can cause you to have cardiac chest pain is high blood pressure, smoking, and high cholesterol. High cholesterol because it causes that plaque. And if someone gets a hold of an ambulance and say they take aspirin for their chest pain while the ambulance is arriving, I'd recommend for them to notify the ambulance how much aspirin they took and when they took it, so they're just kind of aware that you're already starting that anticoagulant. And then if someone has nitroglycerin at home, that's another medication that's used for chest pain. It's important to check your blood pressure with nitroglycerin. you don't want to drop your blood pressure too far down. Nitroglycerin, they usually say take it up to 3 times, 5 minutes apart. Make sure you check your blood pressure before each dose. And you want to make sure that top number stays at least above 100. And then a common side effect of nitroglycerin is a headache. And I'm hoping that whenever I have this discussion that we can talk about people's experiences and just be able to provide information that will help them if they have an incident at home, give them a little education on what could happen with these medications. And then I'm also going to ask if anyone that follows a cardiac diet and what they think a cardiac diet consists of. Lots of people say low sodium, low fat, and low cholesterol is basically the cardiac diet. And it's important to check your nutrition labels before you get anything. Because I know lots of things are high in sodium, and it's important to watch that whenever you're going to a grocery store. And then we're going to talk about some different treatments for chest pain. I want to know how much my group knows about treatments and if they had any of these treatments done. One of the treatments is a stress test. Sometimes they do a stress test first to see how the blood is flowing in the heart and to evaluate the heart medications, how its effectiveness, and see if they need to go in further, let's say for a heart cath. They can sometimes do a stress test first, and then maybe if they want to go in deeper, they can do a heart cath, which is more a little invasive, and it's more accurate. You can kind of go in there and see what's clotted off, if anything is clotted off, which is nice. But if they need to, they can put in a stent, which will open up arteries that are occluded. But if the heart cath, if it's not able to fix the vessel, then they might go another step and consider angioplasty, which is a surgical fixation of the vessel, which also bypass surgery might be recommended. So we're just kind of going to talk about people's different treatments and kind of get an idea of how much everyone knows. We'll talk about those different things. I want to thank them all for their time and ask them if they have any questions, and that's about it for my presentation. Thank you.